Hi, my name is Lucy Thompson. I'm a traditional tattoo artist of 12 years, a medical tattoo expert, founder of the UK's first mastectomy tattoo charity, the Nipple Innovation Project, and a proud TEDx speaker. Thank you for coming to my YouTube channel today. Today's topic is all about assessing scar tissue. So the reason for me creating this channel is so I can share more of my knowledge as one of the UK's leading experts in realistic 3D nipple tattoos. From very early on in my career as a tattoo artist, I've always been fascinated with working with scars. I think a part of that comes from the rebel in me. I remember in my apprenticeship, I had a really old-fashioned apprenticeship, and I had a really old school mentor who was a bit of a dick, to be honest. And I remember him saying a lot of things like don't. He'd never been taught colour, so he didn't know how to do colour tattoos or teach. He also said never touch scars because you will cause more damage and you will harm people and you'll mess people's skin up. And it frightened me. I was like, oh my gosh, I'd never want to hurt someone. I'd never want to cause any damage, especially when I'm covering up a scar. So I never did go near them until I sort of moved on from my apprenticeship and I worked in different studios, and then I opened my own studio, and I was being approached by people that had scars. At first I was kind of reluctant. I was like, oh, I've been told no, that it's the worst thing in the world. But then I heard the stories, and the stories are what got me. I was like, these people are carrying this physical and emotional trauma around with them in a way that's so heavy that they can't see past their scar and what has caused their scar. And that was really upsetting for me. I'm a huge empath. I really feel other people's emotions deeply. I always have. As I've begun to understand myself more, I've understood that I have the ability to help people, to use my skills and my artistry to help people disguise those scars with artwork that they choose, that's empowering, to cover that traumatic reminder of the past, to help people feel whole again. That's what kind of started this story for me to become a medical tattoo artist. I started the Scar Cover-Up project. I started offering out one free scar cover-up a month for free, so I could help as many people as I could. And so I could also gain knowledge and understanding of how different scar tissues react to being tattooed. My YouTube channel is kind of dedicated to medical tattooing, but I might touch on a few mastectomy scar cover-ups as well. My books are always open for scar cover-ups. I just really love the transformative power of seeing scars being covered, and the joy that replacing them with artwork brings to people beneath your very eyes. It is something super special. Let's go back to medical tattoos. There's a lot of different rules and kind of regulations that are out there. As a general rule, when it comes to doing this work, I would always suggest that people have been healed for at least a year after their following surgery. Now, you might note that I've said general rule because it's not a one size fits all for everybody. Some people might be ready from 6 months after the surgery. They may be exceptional healers. Some people may have had 2, 3, 4 reconstructive surgeries. They may have gone through radiotherapy treatment. They could have had delayed healing with their wounds after their reconstruction. They could have had necrosis, which is the death of body tissue, which obviously is, in my opinion, one of the worst kind of scar tissue, most challenging kind of scar tissue to work with. So in cases like that, where people's skin is so fragile and compromised, it is so important to approach these tattoos with caution. And I know that can be hard for people to hear that have been through so much due to breast cancer. I know, believe me. But I have seen hundreds of overworked, damaged, scarred, heavily scarred areola tattoos that have been done in hospitals. It's frightening. Honestly, it's frightening. I know a lot of that comes down to their training. They're only required to do a 2-day course and then they're allowed to tattoo with no previous experience. So to do a 2-day tattoo course and then to tattoo scar tissue is, quite frankly, in my opinion, dangerous, depending on the background that you come from. As an example, to become a traditional tattoo artist, we are required to do a minimum of like a 2-year apprenticeship under a mentor. That's every day. So we can learn, we can observe, we can have someone supporting us, watching us as we work with different skin types, because they all work differently. In a hospital, they don't get the opportunity to do that. Freedom of information requests have shown us that these clinics are held usually once a month. So people do the 2-day training and then they tattoo for a couple of hours once a month. So they are absolutely working to the best intentions that they can to help people, but unfortunately it's the education that's letting them down and the lack of experience and time spent in skin tattooing. Something that I've heard so much over the years, which I still hear now, a lot of surgeons will give the sign off to be tattooed from as early as 6 weeks after the surgery. 6 weeks. Usually in the UK it's around 3 months. 3 months from a surgical perspective, yes, the wound has had time to heal and close, and from a surgical perspective it is healed. However, there's something else going on internally. That scar tissue internally is still fusing together, it's still maturing, it's still healing. If we start to work on this skin that is still going through the healing stage, tattooing always causes a minimal trauma. So therefore we run the risk of causing further damage. And I believe this is partly the reason why I've seen so many overworked tattoos. And the thing that I've found in common with the thousands of people I've tattooed over the past 8 years, I think I've had 9 people come back to me requiring a top-up in that time. And the thing that they all had in common, and this happened to my own auntie, was that they'd received an overworked hospital tattoo, so much so that there was additional scarring on their reconstruction, as well as the scarring from their reconstruction. Simply for someone just spending too much time in the skin, using too much of a small needle configuration. A lot of clinicians have told patients that I've tattooed, oh, it hasn't gone in, so we need to go a little bit deeper. So we do not need to go deeper. That is absolutely not the case. We just need to change our technique and approach, and we can still offer a safe, consistent solution to people that have already gone through the trauma of losing their breast, their nipple. It is, in my opinion, unacceptable for someone to go through losing their nipple more than once. We are literally doing so much better. We have a beautiful charity that is working to build its directory through the whole of the UK and possibly beyond in the future to make this safe, high quality, long lasting, realistic option available to the whole of the breast cancer community. We are doing better. We are evidence of this. We are proof of this. So why? Surgeons don't like to be challenged, and rightly so. They are extremely esteemed individuals as our nurses, and they have vast knowledge and experience, but they're always looking at it from a surgical perspective. They're not looking at it from a tattoo perspective. For me, patient safety is super important all day long, mainly because of all the devastating results I've seen and the stories that I've heard. That kind of thing doesn't leave you, you know? I have struggled with carrying traumatic stories. I really relate to people and I feel the pain, and I try and always spin it and turn it into a positive. So this is why it's important that I set this rule, this general rule of waiting 12 months after any surgery before you can be tattooed. Now, I say to a lot of my clients This really depends on your history, the surgeries that you've had, the treatments that you've had, and I'm always happy to do an assessment 6 months in, 7, 8 months in, to see if they feel that they've healed sooner. And assess this on a case-by-case basis, because absolutely people are ready before then. But there are a number of factors that go into that. So when it actually comes to assessing scar tissue, the best way to do this, especially if you're new to this, is to do it in person. I've gained enough knowledge over the years of what to look out for, what not to look out for, the questions to ask that are relevant to ensure that I find out my client's medical history. So I can assess those scars via a picture in good lighting. But for anyone looking out to start this work, or if you're unsure about how to assess scar tissue, I would always ask your client to come in, even if they're not ready, ask them to come in, physically feel the scars. There's no other way for you to gauge how mature the scars are. We want to feel the skin. We want to feel it. Is there any resistance there? Can we feel is there harder lumps of scar tissue? Is it soft? Is it beautifully healed? Is it ready to be tattooed? What is the colour of the scarring? Is it pink? Is it kind of a purpley sort of grey tone? Is it white? All these things help us learn how to indicate when a scar is mature enough to be tattooed. As a general rule, I always say make sure the scar tissue is white, and that would indicate maturity, that it's ready to be tattooed. Something that's pink, depending on the type of scarring, is showing that it's signs of immaturity, that it might not be ready. But sometimes there's lots of different types of scar tissue, such as keloid or hypertrophic scarring, which can always stay slightly pink or red and raised. And those two different types that I just mentioned should be approached with completely two different types of caution. All of this information is what I go through in my training, and I go through it in much more detail, especially my in-person training, where we can assess a model's scars together. If the student has any scars, we'll be like, right, come on, let's have a look at them. There are so many different scars to assess, and I always think the best way is just to do it by touch and feel. The body will always give you a message. The body will always give you feedback and tell you what it needs, what it's ready for. It's just learning how to read that, and that's the key to success in offering a safe, long-lasting solution. I really hope you found some value in my video today. Obviously, I've just touched on the subject of assessing scar tissue. There is so much more to learn. I'm going to continue this series of sharing little snippets of my knowledge. I have a little bit of a schedule planned out, but if you have any pressing topics that you want to hear, please make sure you subscribe and you let me know in the comments what you'd like to hear, because I'm here to help. I have so many people contacting me on a daily basis asking for advice, so I thought it'd be really nice to have a little hub of videos prepared and ready that I can help people, give them some guidance and some tips on how they can improve their skill set. So thank you so much for watching today, and I will catch you on the next video.